I'm Amber Shada. I'm an assistant professor of surgery at the University of Wisconsin, and I'm going to talk to you today about the SAGES Facebook Mastery Groups. My disclosure is that I am a consultant for Medtronic. We are all connected more so every day, and I think being professionally connected on social media is one of the most gratifying ways that we can connect. So the goals of the SAGES Facebook group are numerous, but they include to connect with each other, to allow collaboration between physicians, to share patient information or to share patient cases, tips, tricks, to provide feedback on cases, and to network, to meet other surgeons digitally, just like we're doing with this SAGES meeting virtually in 2020, and to educate each other. There are 8 SAGES Facebook groups, separate and alongside the program pathways that are listed here. I'm going to go through each of these in some detail and then give you some stats and interesting facts about each one. Of note, these groups are open to SAGES members and all other practicing physicians around the world. So if you're watching this talk and you're a physician, then you should plan to join. This is a study or a statement by Bittner et al. Looking at the SAGES stance on these Facebook groups and informed consent. And the conclusion they drew here was that despite the growing use of social media, that the issues of informed consent still exist, and that it's important. The onus is on the physician to obtain informed consent before posting. Of course, we don't post any protected health information on any of these groups, and that's promptly removed if it does get posted, which is rare. This is the original Facebook Masters group, the Foregut group. It was established in 2015. It has just over 3,000 members now, and it's relatively active, anywhere from 4 to 5 posts a day, anywhere from 20 to upwards of 50 comments a day, and double that in reactions. Of the 3,000 members, over 2,000 are active and have been within the past week, so it's definitely an active group. This is a study by Jackson et al. Looking at the SAGES Foregut group and just focusing in on what kind of posts occur in that group. And you can see that 64% focus on operative technique, 52% on patient management, 10% on continuing education, 10% networking, and 6% other. It's a great way to present challenging cases. If you have questions about a case that is a little bit befuddling for you, it can be a great place to post that. The Acute Care group is another Facebook group. It has just under 2,000 members, established in 2016. And what I found most interesting about the Acute Care group is that it skews a bit young. There's a generous percentage of physicians that are age 25 to 34 in this group. It's 19% female. And among all the countries, these are the most commonly represented countries: United States, India, Mexico, United Kingdom, Saudi Arabia, Egypt, Canada, Pakistan, Italy, and Brazil, each with many surgeons participating in this forum. The Acute Care group has a virtual journal club, which is awesome. They pick a study and then basically critically review that study as a group. And there's CME. The Bariatric group was established in 2016. It has about 2,000 members, and the membership is quite robust in the mid-1000s, but it's grown significantly during the COVID shutdown. And I think that's due in part to Dr. Gondon's GJ challenge. This was his post where he posted a GJ anastomosis with technique and then tagged others, and they tagged others, and overall 76 videos on GJ technique were submitted. The Flex Endo group was established in 2016. It has just over 1,000 members, and it boasts the largest percent increase over the past 3 months, 76% increase in members. The COVID webinars were a huge success in SAGES endeavor over Facebook. There were 18 total webinars during the COVID lockdown. 3 of those were the Flex Endo, but they scattered across the other Facebook groups as well, and they're available still at this website here. And then the Facebook groups can be helpful just to post cool cases of things you've seen. This is a post about a spats balloon, which isn't something we commonly see. The Robotic Facebook group, established 2016, has about 2,500 members. Membership also has increased steadily over the past 3 months, 56% increase. And the Facebook groups are a great place to solicit tips and tricks for surgeries. Here's a recent post looking at someone who has a right adrenal coming up and is wondering about tips and tricks, and then people put in their suggestions on surgery. I think it's a great place to solicit things like this where it might not be as easy to find. And YouTube has certainly a lot of things, but the SAGES groups are very vetted. There's a lot of experts that are closely checking what's posted. The HPB group was established in 2016. It has just over 2,000 members and a scattering of countries that are represented. The United States, India, Mexico, Egypt, Brazil, United Kingdom, Pakistan, Philippines, Saudi Arabia, Canada. So these are really international groups. I love that about them. Networking is something that the groups are used for. Let's say you need care for a patient that you operated on but lives in a different state. This is a perfect place to post and find the surgeon. The Colorectal Facebook group, established in 2016, is one of the bigger groups. It has over 3,000 members. It's also one of the more active groups with many posts a day and upwards of anywhere from 20 to 100 comments and reactions every day. Of the 3,500 members, 2,500 or over that really are active within a week's time. So again, a very active group. Member polling is a great way to see what others do. You know, we can always stop down the hall at our partner's office, but it's nice to have dozens or hundreds of opinions as well. So you can put out a poll and then ask people what they think and what they do. It's great for topics where there's not great data or the data is conflicting. The Hernia group, established in 2016, has just over 2,000 members. Again, the 25 to 34 demographic is strong. 35 to 44 is most common, 16% female. And video review is one of the ways that the groups are commonly used. So people post videos and then people watch them and provide comments and criticisms and suggestions. So tips for these groups. I suggest you join all of the groups that fall within your area of interest. Introduce yourself and get involved on them. Post videos, ask questions, comment on posts. You can adjust your notifications so that you're not getting overwhelmed with social media updates so that you can go on your time. Contribute to discussions, as I said, and then connect offline. If there's people that you think networking will help your career, you should do so. So in summary, I think these groups have really changed my life and my practice, and I think they really provide a great, important service that SAGES has provided for us. Thank you.